In this model, we have a 12-lead EKG, the heart model, and the corresponding coronary arteries that are demonstrated. For the anterior leads, we will focus on leads V2 and V3 through 4. If you see 2 of the 3 leads, that indicates some ischemic injury or infarction patterns, and this is described as contiguous leads, as mentioned earlier. We must have at least 2 contiguous leads in the EKG pattern for a diagnosis of ischemia, injury, or myocardial infarction. So let's look at leads V2 through V4. Clearly, this pattern, we see some T-wave inversion actually in all 3 leads, as demonstrated here, inverted, and also here in V4. This is very helpful to match this with the patient's clinical signs. All are indicative of an acute anterior MI. In the myocardium, examine the flow. There is clearly a blood clot and or a spasm of the left anterior descending artery, or LAD. Let's review this example of a real EKG. Note the lead 1, 2, 3, AVR, AVL, AVF, V1, V2, V3, V4, 5, and 6. Can you determine the ischemic changes and the location? Let's move forward. Here we see ST segment elevation in V2, V3, and V4. These are our definitions for an acute anterior wall MI. Example 2. Lead 1, 2, 3, AVR, AVL, AVF, V1, V2, V3, V4, 5, and 6. Using our approach, we'll look at the inferior leads first, 2, 3, and AVF. Any ischemic or injury signs? Lateral, 1, AVL, V5, V6. Septal, V1, V2, and anterior, V3 and V4. Let's see where the ischemic changes are acute. Here we've highlighted V2, V3, and V4. Clearly a large ST segment elevation is noted in V2, V3, and V4, a large ischemic pattern. This is an acute anterior wall MI.